Welcome back, everyone, and to our closing session. I hope that you enjoyed your lunch and the opportunity to talk with colleagues and explore new connections. Before we get started, we have a special video message from one of the Roundtable's key contributors who could not join us in person today, so please direct your attention to the screens.
Hi, I'm Kalen Jackson, one of the owners of the Indianapolis Colts, and on behalf of my sisters and I and the entire organization, welcome to Indiana Farm Bureau Football Center. I am so sorry I'm unable to join you in person today, but we're happy to have the Indiana Mental Health Roundtable at our headquarters. Here at the Colts, we have a mission that guides us every single day: to entertain, inspire, and unite by winning the right way. Yes, that means we spend much of our time focusing on football, but it also means we care just as much about what we accomplish off the field as we do on the field. That's why we're so dedicated to mental health and to our initiative, Kicking the Stigma. Through Kicking the Stigma, we're able to use our platform to bring people together, raise awareness about mental health, and foster positive change in the communities where we all live. Because whether we talk openly about it or not, everyone in this room today knows someone who is suffering in silence. That's why we all should understand the struggles mental health illnesses create for individuals, families, and communities. And as the summer has already covered today, mental health challenges are also an obstacle to building a stronger economy in Indiana and nationally. The working hours and business productivity lost to mental health illnesses are countless and truly prevent us from being the best we can be. That's why we hope to be a leader in supporting our own employees with their mental health needs. So in closing, thank you to the Roundtable for its work to keep this issue at the forefront of public conversation. And thank you to everyone in attendance for working toward a state and a world where mental health is truly valued.
Thank you so much to Kalen and the Indianapolis Colts for their ongoing support of the Roundtable and its mission. We also want to once again recognize our sponsors who make events like this possible. So please give them another round of applause. As I wrap up my MC duties, it's been such a pleasure spending the day with all of you and hearing so many meaningful conversations about the future of mental health in Indiana. I took some notes, so I'd like to share a few takeaways that I learned today. The first one is passion. We heard from our keynote speaker, Braun, that you can feel the passion from someone when they're speaking, right? Well, I hope that you leave inspired or re-inspired to have that positive energy moving forward, because you really don't know how you can impact someone just by being kind and having that energy. Courage. Have the courage to say, I'm not okay. Even the bosses like yourself need help every now and then, so please have that courage to do that. And thank you to the Indiana Mental Health Roundtable for having me today. I truly appreciate you guys. You know that the stigma surrounding addiction and mental health awareness is near and dear to my heart, so I really enjoyed being able to be here with you all today. And again, thank you to the Indianapolis Colts for allowing us to use this beautiful facility. Now, before we dive into our final conversation of the day, we would like to share a short mission video with you, followed by remarks from Brett Kramer, Director of Kicking the Stigma for the Indianapolis Colts.
Kicking the stigma.
Kicking the stigma.
Kicking the stigma.
One thing for sure is that the situation is more dire than ever.
10 years ago, the truth is that this was not talked about. In my world, my circles, certainly not in the NFL.
It's okay to not be okay.
It really, truly does affect every single person on the planet in one way or another. And
Kicking the Stigma is our commitment to eradicating and getting this environment changed.
The power and platform of the Horseshoe gives us the opportunity to bring visibility to mental health and create conversations that it's okay to not be okay. We've seen such a great response across our community when we've created opportunities for collaboration and conversation. By simply meeting people where they are, it shows us how much progress we can make together in this space. Since 2020, we have committed more than $30 million to support awareness, access to treatment, research, and evidence-based practices for mental health. Every dollar given is intentionally dedicated to funding organizations who are working tirelessly to address the mental health crisis. We've seen mental health statistics drastically improve within the state of Indiana from a collective effort to shed light on this crisis. Each year, we are seeing more NFL teams join us in this cause, and we are confident that this will continue to grow throughout the league and beyond.
It doesn't matter who you are, we are all bonded together in trying to overcome this stigma.
Hello, good afternoon, everybody. As Rachel mentioned, I am Kramer. I'm the director of Kicking the Stigma with the Indianapolis Colts. We're so grateful that you're at our complex today. And I know many of you would have loved a sneak peek at our practice earlier, but as you can imagine, we need to keep those things locked down as we're doing quite well this season, so go Colts. I love it, And special thank you to the Roundtable for putting together this summit. It's so incredibly important that we bring together leaders from across all industries to not only talk about mental health, but also take hopefully a moment in time to think about our own mental health and how we're reflecting on that, because it really starts from the top in setting that example for your employees that are working under you. I would be remiss if I didn't do a special shout out to both Nicole and Nicole from our Gridiron events team for all their work putting this on today. They are the hidden gems behind the scenes for all events that happen in Gridiron Hall, and I just want to thank them for their hard work day in, day out, and the much deserved recognition today. So if we can give Nicole's a round of applause. As you saw in the video, the vision of Kicking the Stigma is really to be an example, convener, and catalyst for strategic change in the mental health sector. And we do that by using and utilizing the power of the Indianapolis Colts horseshoe to really make that change. We understand that we have a prominent brand, not only in the state of Indiana, but throughout the country and the world, being a part of the NFL. And we like to use that for good in the mental health sector. And as you can imagine, in our walls, in our building this year, there is a huge loss, in the loss of our late owner, Jim Irsay. And there's one thing that we are so proud with his legacy that we're carrying on through Kicking the Stigma, is how he has been an example of what it means to talk about mental health and not be afraid of any ramifications that come with it. So we're grateful that he set that example, not only for our organization, but has clearly made that impact throughout the state of Indiana and beyond. Once again, congratulations to the Roundtable on this moment. I said a huge thank you to Brian Mills earlier today after he gave his remarks, because his OBGYN at Community East did not induce me yesterday, so I'm so glad I could be with you all today. And then I also can confirm that you cannot bring a baby to a doctor's appointment without other people involved as well. So once again, thank you so much for your time today. Thank you for making mental health a priority in your communities. Thank you for being at the Colts Complex. And with that, I would love to introduce the co-chair of the Indiana Mental Health Roundtable, Marvin Richardson.
Good afternoon. Thank you, Brett. And this is a beautiful place, especially when you're 6-1, right? Yeah. So Mike Braun is the 52nd governor of Indiana and a conservative outsider who spent his career as a Main Street entrepreneur, building a business and creating thousands of good-paying Hoosier jobs before being elected to the United States Senate in 2018. Mike's lived the American dream, and as governor of Indiana, he'll work to preserve the same freedom and opportunity to achieve prosperity for future generations of Hoosiers. After graduating from Jasper High School in 1972, he attended Wabash College. At Wabash, Mike's graduated summa cum laude with a degree in economics and as student body president. After college, Mike married Maureen, his high school sweetheart, and the two moved to Boston, where he attended Harvard Business School and earned his MBA. After a few years working for a national kitchen cabinet company in Jasper, in 1981, Mike got the entrepreneurial itch and took over a struggling truck equipment company called Meyer Body. In the early 2000s, Meyer began to grow into a regional company, and over the next 15 years grew into a national company that currently employs thousands of Americans within locations in 38 states. The values of faith, family, and community guided Mike while growing a business and raising a family, and have inspired his call to serve fellow Hoosiers throughout the years. Mike's been a conservative voice for Hoosiers since his historic victory in the 2018 U.S. Senate election, having led over 40 bills into law, and he was named the most effective first-term Republican senator. Mike has consistently been ranked as one of the most conservative members of the U.S. Senate, earning endorsements from Americans for Prosperity and CPAC, and maintaining excellent ratings from the NRA, Family Research Council, National Right to Life, and Susan B. Anthony list. Please welcome Governor Mike Braun. So Governor Braun, thanks for being here.
My pleasure.
We've both been CEOs of private businesses, business leaders, and I'm sure some of the insight we'll get from you today is from that lens, right? In addition to being the lens at the top of the Indiana government change today. So as co-chair of the Indiana Mental Health Roundtable and someone who has a mental illness, bipolar disorder, this conversation is both professional and deeply personal to me. Our summit brings together employers, policymakers, advocates who believe mental health is not only a moral imperative, but a business and community priority. So today I'd like to explore with you how your administration is approaching mental and behavioral health, and how the public and private sectors can move together from awareness to measurable progress.
Very good. And thank you for having me. And the first time we met, I knew we'd hit it off on the entrepreneurial side of life. And I think the thing that, for those of you that don't know, and it wasn't mentioned in the intro, the proudest thing I've done in my career prior to becoming a senator or a governor was addressing healthcare. Of course, back when I took it on in 2008, mental health wouldn't have even been in the discussion, even though it was there then. It's just that the industry didn't look at it holistically. But when I was tired of hearing how lucky the company was when we finally grew out of a hard scrabble existence where you had 20 employees, healthcare in general was a very small percentage of our GDP, and we got to 300 employees in 2008, I couldn't just dismiss how much it was costing, number one. And now, where it was probably 10 to 11% of our GDP, it's approaching 19%, and we're still not putting the resources to the mental health side of it. But in fixing it, it was clear that if you didn't do something different, you were going to just scratch the surface on trying to fix it. So in that one renewal meeting, when I found out how much the insurance companies were making on the plan, I decided to self-insure. And then when I asked them, how do you reduce those claims? It was clear, it was easy. Start changing your approach from expensive remediation to prevention and wellness. Sounded kind of abstract. I didn't know if I could translate that into savings, but the other thing they told me is turn your employees into healthcare consumers. So I did all of that and walked away cutting our healthcare costs by nearly 60% plus, created a better system, have not had premium increases now in 17 years, and now we're at the cusp of where we need to give that same attention to mental health. Visiting all counties each year, it's amazing how many counties, normally through the addiction side that's intertwined with mental health, have done things on their own because they've not gotten it through their private healthcare plan. Most of the healthcare plans, just have not addressed it. We're right at the cusp of that occurring. So much of it to make sure you're not treating it in a very expensive way has to be addressed. That means we need to get rid of the stigma. We need to make sure we're catching it before it has gotten to where it's going to be expensive to treat. And that'll be the general framework I'm going to try to approach it, not only with our own Indiana healthcare plan, but trying to set the template for the other plans. And for those of you that don't know, so much of our healthcare is being done through Medicaid, disproportionately more even than Medicare, and we'll need to make sure that the feds come along and try to adapt some of the smart best practices that I think we'll craft state by state. That's kind of long, but that's an intro in terms of a framework that I think we need to take to approach it.
Sure. So how can business leaders, and there's a lot sitting here, large and small, empower their employees to seek care for mental health?
So you'll need to do similar again to what I did back then. We kept physical health care costs down, and we've not ignored mental health care costs. But there you had to work at it to actually find out how do you find those early symptoms, and then what do you do about it when the industry wasn't really out there giving you much to work with. So we're going to need to refine that part of it that actually gives you reasonable prescriptions to improve, modalities to go after it. And then it's mostly going to be for companies to make sure you're not sticking your head in the sand. You realize that this is now going to be something that costs on top of what your current plans are. And most companies I know are not happy with the cost of that. So if you want to wait until it gets too bad, or you're going to wait for some solution without being proactive in searching for one, you're probably going to be disappointed of being behind the 8 ball in finding a solution.
So what are your top 2 or 3 mental health priorities for Indiana during this term?
So we can do a lot that can serve as an example of what you can do more broadly. The state is a sprawling enterprise of about 70 agencies, 30,000 employees, and our own healthcare plan there is one of the most expensive in the state of any institution, and it's putting very little emphasis on prevention and wellness. So as we retool it, we're going to make sure we have an attentive eye to the mental health side of it. So number one, we can use it as a very large sample size to see how we can address it there. And then whatever works there, legislatively or administratively by executive order, we try to put the template out there for the private side. And then I think the other thing I can do as a leader of the state is make sure you're talking about it, so it's resonating, so that we do this and then it's not going to be falling on either deaf ears or to where they're not hearing enough about it. So I think those would be the 3 prongs that I'd use to go after it from here forward.
Where do you see the private sector, employers, payers, community partners, playing the most meaningful role in achieving those goals with you?
So when I got to the point where I had to pay attention to workforce, healthcare, all the things we were hoping, maybe government or the educational system to just throw on our lap, a lot of times it wasn't there. And I see the most entrepreneurial companies on something that's beset our state for a long time with our low unemployment and trying to sync up workforce and skills with what we need through higher ed. It's kind of an example of what we need to do, because from prior administrations, we've got education in a place I think it's never been before. And a lot of addressing this is getting this out as an issue in all ways that you can. I think Suzanne might be here today, and she started the whole journey to make it an issue in state government, and thank you for it. And Katie Jenner on the education side, which is K through 12's half our budget, we've got a dynamo there. So I think a lot of it is going to be to where, yes, we through government, but then I advise CEOs, we relied too much in complaining about government not doing it. Look to see what they do that you may want to kind of investigate to see what's working, but don't address it late. The companies that have done the best on workforce are the ones that were doing apprenticeships, getting involved in their own high schools. I'll use Toyota as an example down in my neck of the woods. Many others are doing that now. But you've got important parts to your own businesses, workers, their health, mental and physical. Be proactive, be a little adventuresome. I'm going to try to show you some things that we can give to you through the state, but be out there, be proactive with it. So often the private sector wants government to put it in their lap, and I think in this case, you need to be out there finding solutions yourselves as well as what government might do.
So Indiana's made progress in crisis response, 988 and CCBHCs. And, you know, I know and I believe our 988 response in Indiana is one of the highest at about 94%. We heard last night, we had a roundtable dinner and heard that early returns on CCBHC in Indiana is very positive. So, and you and I both know this from previous experience, but what's the plan to invest further upstream in prevention, resilience, community wellness, obviously being more proactive than reactive before crisis hits?
So the good news is we're blessed with a state that's been run pretty well. And despite the budget forecast that threw a monkey wrench into kind of what we were able to do through session, I knew that was going to be something that probably wasn't going to be accurate. We're already cash flowing in a way that once we get the next formal forecast, it's going to put us about where we would have been anyway. So that means we're going to have resources. We've been blessed to where we, year after year, keep reserves. But even for a well-run state government, there's only so far you can go until you know what the best practices are. And I think your roundtable hopefully is going to be get out there, get us proposed legislation, give us ideas on what to do. Because as I said earlier, we're all at the beginning of a journey to where it's mostly been unattended to. So my career was as an entrepreneur trying to get ahead of my competitors. One thing we did there that most didn't do, and I was a foot dragger on it, was embracing technology. Well, that was one place when I got to state government, it was probably not being done well. When you embrace technology and what we've got at our disposal now, that'll be something that I think gets woven into it. But I'm going to be looking hard at what's happening around the rest of the country. I'm going to invite anybody that's a stakeholder in it, get with us, tell us what those best ideas are, and then I'm going to get it from here to there as fast as any governor can do it. And I think we're going to have a legislature that's willing to tackle it as well. So I think the prescriptions, the solutions are still in front of us. All I can tell you is I'm going to be looking for them. We're going to have resources to devote to it. And one of the places out of the gate that we got real good is addressing autism. And then we got so good at it that it got us in a financial pinch to where it, through Medicaid, started making it difficult to actually keep up with the demand. All of that gets complicated, especially when you got something amorphous like mental health. How much of there is it, and how much is it going to cost to do something about it? And that'll be no different than when you're trying to run any business. The only big difference here is there's only one government. We don't have competitors out there. We've got good cash flow. So we got a lot of advantages to bring to bear too.
So you recently launched Make Indiana Healthy Again, and a framework for that. So how will behavioral and mental health be integrated into that initiative?
Well, I think now the clearest thing you can say is that there shouldn't be any stigma to it. And even though we haven't done a lot, nor has any other government, I think mostly I've seen counties and localities trying to deal with it. We will make sure it's being considered at a level that I think now has risen to the point where most people think it needs to be taken seriously. And when it comes to how we navigate through it, it'll be my job as the leader of the state to make sure we're talking about it, and then to get all the things we've been talking about amassed and do it in something that's not going to be a flash in the pan, that we build a solid base, and that we build, hopefully, the best system that's addressing it. And so much of that, Marv, is yet to be determined.
So how will you ensure people with serious and episodic mental illnesses aren't disenrolled from care, under new eligibility rules?
So I think there, depending on how much of that's coming through Medicaid or how much of it's coming through the private system, the part that we'll be able to weigh in on will be Medicaid. And I'm just going to tell you, that's the part of the state budget that is going to be the hardest to control. Every year it's going to go up. A lot of it has to do with, fraud within a system, eligibility where some people are on it, where they shouldn't be, to where it's not addressing the ones that need it. We found out just in a cursory review that there are probably 10% of the people, or a high percentage, that ought to be on Medicare that are still on Medicaid. So pick some of the low-hanging fruit so that we got the resources. And I think the fact that I'm here, you're leading this, it puts it out there publicly to where we're not hiding from it. And then it's going to be a question of, even if it's going to require more resources than what we've got readily available, you're going to have to figure out how to plow through it.
And what steps are you taking to expand access into rural and underserved areas, which is always a big consideration for us here at the Round Table?
That's getting to what besets the physical side of healthcare. We've got about 7 hospitals in the state that are just doing unbelievably well, and we got over 100 hanging on by their fingernails, and that would be all rural, and some even in places that you wouldn't consider rural. So that kind of broken system on the delivery side of it is something we need to look at as well. And mental health would apply there as well.
So I know this from our conversations before with our distributing and my business in pharmacy automation. You've called for performance metrics across the government. Will your administration commit to publishing annual behavioral health outcome metrics, access, suicide rate reduction, workforce expansion, so that we as Hoosiers can track real progress over time?
When I ran on 2 things: accessibility, that's this, and transparency. And we've already gone through places in our own state government that we're opening up to full transparency. And of course, accountability or metrics should be the things that you're doing with anything if you're spending a lot of money. So I've already been out there. I campaigned on it. Whatever we do in mental health will be just like we're going to do in the rest of government. You're going to be able to see it, because I want you to be there critically analyzing it, giving us ideas if we're missing it so that we can do something about it. I don't think in any business that's successful, transparency is going to kind of be up to how much you want to have, maybe offering to the outside. I'd hope that you would embrace that for within your own company, because otherwise you're probably suppressing good ideas, sticking your head in the sand. But almost all successful enterprises are going to be measuring and having accountability. Government oftentimes doesn't hold itself to that rigor that you have to, again, when you're in the marketplace competing.
So campaigns like Kicking the Stigma have moved the needle, and believe me, as someone that has bipolar disorder, that is an important initiative. But many Hoosiers, including employees, still hesitate to seek help. It is an issue. I've lived it. How can business and political leaders lead by example and normalize mental health as part of everyday well-being?
So probably the place that you'd get that first is if you can get that kind of inculcated into the education system at an early age. So when you aren't acknowledging it maybe at home, you're able to see it there. And then just keep pushing that idea that it shouldn't be stigmatized, because so often that's going to come from maybe someone else in the family that's willing to speak up, because that is a very ingrained thing to overcome. And I think you'd have to hit it from both sides. And again, that'll be part of the mantra, part of the message that you get out. And hopefully your own roundtable will keep pushing that out as one of the first things that we need to build better public awareness of.
Yeah, and I think it's important, and think about this as you move forward, schools, workplaces, and leadership training around that stigma. And how do we break those barriers? How do we continue to move them? And would love to get your thoughts on what you think we need to do there.
Well, I would ask everyone, including your roundtable, if we're not hitting it in terms of what we can do through government, it's never going to be as quick there as it would be if you really grabbed this by the horns on the private side. And it's going to be an interactive, I think, navigation going forward. And since we're so early on the journey of getting it out there to where we've acknowledged it, I think a lot of this we're crafting. And I can tell you, on the education front, we're already being looked at as the state that is jumped ahead of others. And kudos to everybody that had been part of it before I got there. A lot of those blessings were already in place. And healthcare reform, I worked on it so hard, I don't think we're going to get the solution. Remember, you got to get 60 senators to agree to that. Try getting 60 senators to agree to anything when you got the ideological rift there to deal with. But even there, I found a way to work with the other side of the aisle on practical stuff. And if this isn't in the range of practical, I don't know what would be, but I would still think that enterprising states, entities within the state and the private sector, they're going to probably find the way before we'd have a solution from DC. And whenever we get it from there, it's always going to cost more, and generally it's clumsier to implement as well.
So sort of going back to your experiences at Meyer and being CEO, how did your private sector experiences shape your views on mental health in the workplace? Do you have specific examples? Do you remember, times when you thought about that and how you wanted to change approach?
To be honest, for the first at least 17 years of the 37 years that I was running it, it was more about survival than it was articulating any of the stuff we've been talking about. But once I figured out that we were going to survive, and then I had something that had invested 17 years in, how to scale it, I can tell you the biggest factor in anything is how much risk you're willing to take outside the norm. I get asked all the time, now that you're a senator, a governor, and build a business, what are those key things that differentiate you from your competitors or others that may not make it? Risk profile is definitely number one. Number two would be, do your ideas make sense? And do you have the judgment to actually pick from among them? So to me, that dynamic generally flourishes in the private sector. I can tell you that analog is what I put into place in those 6 years I was in the Senate, and that's why I think it was in the third year I was there, we got more legislation passed than the ones that have been around there 2 to 3 decades. So stick your neck out. Don't look at the normal tools in the tool chest. Try to pick the right fork in the road and then work your tail off to make sure you implement it if you get a good idea. So those are the things I'm going to try to put into place. That's what I inherited from the private sector. And here's the big difference. There, if you screwed up, you were on the ash heap and you may have lost your home because you had to mortgage it to actually get the funding to do it. And here in government, it's a lot easier in that you generally don't have as much risk being taken. You're not thinking out of the box as you would in a private sector, but we're going to be doing that in Indiana, and I hope everyone's noticed that already in all the areas that we can weigh in, and I'm inviting the rest of Hoosiers to help with good ideas. And I put together, first thing I did to make sure we can get traction on this is we had 70 agencies. There was only one portal to probably get a good idea to the top, and that was an overworked job, chief of staff. I've hired and had 120 people help me find entrepreneurs with government experience that had 8 policy silos. And we're getting just a lot more done in the array of government. Take advantage of it. And it should be a lot more responsive, should enable us to get things from great idea to actually something that we can do administratively or translate it into legislation if you need it to authorize it.
You emphasized, sort of this business leadership of all corners of the state should prosper. What opportunities do you see for rural business to better support employee well-being?
So you talking about rural businesses related to mental health?
Yes.
Or rural businesses in general?
Related to mental health.
So the one thing I noticed a couple, 3 years ago, and I don't know the name of it in Kokomo, but they took an old school and devoted a lot of square footage to mental health and addiction. Almost every county, even the smaller ones, have done it. So that means nonprofits, maybe they're getting the business communities there involved, have already got somewhat of a grassroots approach to it. So I think there I feel better about kind of not having to make the case in a granular way. I think it's already there. So again, anyone that can get to where they're solving the problem first, we're going to be visiting all of those counties. I'm going to be asking, how you doing in this arena? And we're going to see some places that won't even shout it out. They won't be heralded for it, but we'll be looking. So that's the one thing that makes me feel good about the fact that we're not going to be starting from scratch. And I think that then will mean there will be businesses, entrepreneurs, healthcare innovators that may come, from the bottom up as opposed to something coming from the top down.
So we've got 5 minutes or so left. One thing, what is one tangible step we can all take, employers, policymakers, community leaders, in the next 6 months to move Indiana's mental health agenda forward?
So I'd say whoever your employer is, get with them to make sure that the benefits are going to address mental health. Most of them are still out there on the horizon somewhere, not really doing it. Mention it to your HR folks so they're looking. Generally, when you're trying to incorporate it into an already expensive part of any business, it's going to naturally probably get the response, well, I'll think about it and we'll put it on the work list. But I think if you bring it up, that can't hurt. I think the most enterprising companies, and I'm not sure I'd say government in general would be in that leading edge. They a lot of times do things, but they do it in ways that are very expensive. And remember, we've got to do this to where it's affordable so we can actually devote resources to it. And a lot of our healthcare plans, the ones that are the richest plans out there, cost 3 to 4 times as much as other plans that actually have much better results when you compare what you're actually accomplishing. And that's because so many of them have never tried to attack the cost of healthcare in a way that brings it down. They just want to find ways you pay more to find expensive remediation that won't be the solution. Because if we try to throw this on top of a healthcare system that is double what it costs 25 other countries that have different approaches with similar or better outcomes, we'll never have the resources to do it that we'll need to have. So that is part of what concerns me, but I also am hopeful that we'll get there.
So I'll tell an anecdotal story, and then I'm going to give you a few minutes for some final comments. But I had an opportunity to meet with the governor last week and talk a little bit about what we wanted to do and what I wanted to do with the questions in the segment. And what I was struck most by was, I think we were supposed to be there 10 minutes. We were there 30. 20 minutes was spent on my journey, right, with mental illness. And I thought that was interesting. I think if you take that approach of being interested in exactly, how did I get from where I was to where I am today, take that approach to Hoosiers in general going forward in this administration, we're all going to be better for it. And, I wanted people to know that. So.
Well, thank you. And that brings up an interesting, when you do get asked what were some of the key things that helped you. And the hardest thing I ever did was running for Senate when I had no name ID, and try explaining that to your wife and family when you're 1% in the polls. And that was 14 to 18 months, 6 days a week, 14 to 18 hours a day for 15 months, 6 days a week. And you have to fight through that. Here, when most of the good ideas I came up with in running my business, it was gleaned from 3 sources: competitors, employees, customers. And I'll throw one other one in there: suppliers. So I did mostly listening, and then I'd ask a few questions after I heard the story. There is so much you can glean by listening and then distilling what the most important part of it is that you heard, and then it generally gets put on the shelf. And if you're willing then to put some action behind it, I remember when my brother Steve, we were the only 2 legislators evidently that ever served at the same time. It was for one day when I ran in 14, he did again, and then Governor Pence tapped him to be heading the Department of Workforce Development. But he was really keen on making sure that we had the data to know what the high demand, high wage jobs were, and spent a couple, 3 years doing it. And again, if you don't have the apparatus there to do it, or maybe the knowledge to implement it, it did not get put into place. And we're right now at a point where I think we've got that pretty well figured out. Some of the work done between when he was there and what's got done in the meantime, but I've got an enterprising Secretary of Commerce that's going to make sure that all gets incorporated. So here, I think it's very clear. I'm interested in trying to find out how Indiana can lead in the sector. All of you think about this conversation. You're here because you're interested in it. And I'm happy to meet with anyone outside of this at the Capitol, in the residence, up to a half an hour, 45 minutes, to flesh out more in detail. And I'll do that. The Secretary of Healthcare and the other employees we have there, we're asking for that help. Make sure that we get it, and if we don't, you can get to me if I'm running into places in my own government that's not being receptive to it. That's about as much as I can do to say, hey, bring it to us. Let's do it collectively. Let's show what Indiana can do to lead the nation.
Well, thank you for your openness and your time today. I know it's valuable. This conversation obviously reminds us that mental health belongs at the center of Indiana's workforce and community agenda going forward. I can tell you on behalf of the Mental Health Roundtable members that are sitting here, my co-chair Ann Hazlett, that we appreciate your leadership and partnership. We will be back to you with ideas that we can think of and take you up on the opportunity to sit down and talk further about it. And we look forward to helping turn these ideas into outcomes for Hoosiers as we move forward. So thank you again.
I'll count on it, and thank you for listening.
Thanks. Thanks very much.
Please welcome to the stage President and CEO of the Indiana Philanthropy Alliance, Claudia Cummings.
Wow, what an extraordinary day this has been. Thank you for welcoming me. You are officially my first audience as the outgoing president and CEO of the Indiana Philanthropy Alliance, and it's great to be here with you today. We've heard from business leaders, innovators, and public officials, all united by a shared belief that mental health is not just a personal issue, but a collective priority that shapes the strength of workplaces, our community, and our great state of Indiana. Today's conversations remind us that meaningful change doesn't happen in isolation. It happens when we join forces to design and invest in innovations that truly meet the needs of the people. Throughout my career, I've had the privilege of seeing what happens when people come together around complex challenges and commit to solving them creatively and collaboratively, having witnessed the power of strategic philanthropy and cross-sector partnerships through my work at the Indiana Philanthropy Alliance and as a board member of Sagamore Institute, I can confirm private sector leadership, when combined with community insight, creates lasting impact. At the Indiana Philanthropy Alliance, the work focuses on leading change and improving outcomes for Hoosiers. Through those efforts, I've seen foundations, corporations, and community leaders work together to address issues from early childhood education to housing to workforce well-being. Increasingly, these conversations include mental health. Sagamore Institute, an action-oriented think tank dedicated to building and implementing innovative solutions to some of the world's most pressing problems, is not a place where ideas sit on the shelf. It's a place where ideas come to life. The Indiana Mental Health Roundtable is a perfect example of the ideas in action from Sagamore, bringing together leaders to align, amplify, and scale solutions that support Hoosiers' mental health and well-being through convening, advocacy, and innovation. Within the Roundtable's innovation pillar, we're excited to see the launch of the Hoosier Mental Health Funders Collaborative. It's an effort supported by the Indiana Philanthropy Alliance and designed to bring funders from across Indiana together to explore what the future of mental health can look like in our state. Beyond being a place for funders to meet with one another, this collaborative is a place to create deals, real investable opportunities that deliver impact for Hoosiers. We look forward to sharing more in the coming months, but we invite you to engage today with the immediate work of improving Hoosier wellness. Every leader in this room, every single one of you, and every one of your neighbors, so just take a moment, every leader in this room has a role to play in shaping a healthier, more resilient Indiana. And there are clear next steps you can take now to keep the work going. First, engage with the Wellness Council of Indiana to access resources, education, and consultative support that helps bring mental health strategy into your workforce, your workplaces. Second, stay connected with the Indiana Mental Health Roundtable through engaging with the work of individual IMHR members like Kalen Jackson, who we heard from earlier, as well as IMHR communications like following the quarterly newsletter and LinkedIn. Those are great places to get started. And remember, these are actions for you. Number 3, this is your third choice, or you could do all 3. Number 3, leverage your personal and professional networks. We all have them. Use those networks to influence the leaders in your organizations, your communities, and create a ripple effect that strengthens Indiana's mental health ecosystem. Every action, big or small, contributes to a stigma-free culture where mental health is prioritized and people can truly thrive. Thank you for your energy and your leadership and your commitment to this important work. Together, we can keep moving the needle, building healthier workplaces and a stronger Indiana. I look forward to seeing the impact we can create together. Safe travels, and please take a floral arrangement and a print out of the materials on your way out. Have a great afternoon. Don't forget one of those 3 actions. Thank you.